Okay, there we go. So, we are talking about homeopathic remedies for families or households. This is part two. It's just part two because it's too long to talk about all my favorite remedies in one session. It's just too much. So, we divided it in half, and this happens to be M through Z. Truthfully, it's M through U because I'm not talking about any remedies that go past U. There are some remedies that start with Z and Y and X, but we're not going to be talking about those tonight. So this is me, Alexis White. I'm a classical homeopath. I have a women's healthcare and self-care practice. I'm a teacher and a speaker. And this is my contact information, which you don't have to rush to write down. I will have that at the end as well. And as I said to you all before, but for those of you watching this video after the fact, the part one video and the introduction video are available on my website. So if you go to About Homeopathy, you would scroll down the menu to past webinars and classes, and you'll find all these webinar recordings that you can watch anytime you like. And I have other webinars on there as well as in-person recording classes also. So we're going to talk tonight about homeopathy, and people often ask me, what is homeopathy? And people sometimes confuse it with other things, and people conflate homeopathy and naturopathy. So tonight we're going to start by talking about what homeopathy is not. So there are many modalities of natural, alternative, complementary medicine. You have naturopathy, traditional Chinese medicine, acupuncture, herbal medicine, many more even than that. And each modality uses their form of medicine based on their distinct principles. And so what homeopathy is different because the medicines that we use in homeopathy are prepared by dilution and succussion and are given according to the principle like cures like. And this is what makes homeopathy unique. There is no other modality of medicine that uses medicines in this way. And so it differs from all other forms of medicine, including allopathic medicine. And we call allopathic medicine means any kind of Western medicine, having an allergy shot. This is all allopathic medicine. That's when we go to the doctor. That's allopathic medicine. So it is distinct and different from other forms of natural medicine as well as from allopathic medicine due to the medicines we use and how they're made. So the basics of homeopathy are that it's energetic medicine. We're giving minute diluted doses of substances made from remedies that are made in a very specific and particular way. It's gentle with no side effects. There are no contraindications for homeopathy. So there's no interference between homeopathy and other types of medicine, from supplements, natural medicine, herbal medicine, and even prescription medicine. It's safe for all ages and conditions, from babies all the way up to elders, including your pets and any condition that they might have. It's inexpensive, it's non-toxic, and it's green medicine. What does green medicine mean? That means that the footprint that we use to make homeopathic medicines is very small. We use very small amounts of material, and then essentially we just use sugar pills and water. And that is how homeopathic medicines are made. So they are non-toxic to the environment in their creation, as well as being very green and friendly to the planet. They're widely available at health food stores and online. The books that you need to use homeopathy at home are inexpensive and easily available. And homeopathy is based on simple principles that anyone can learn. And if you watch my introductory video, you'll see that you too can learn them and understand how to practice homeopathy in an acute manner at home. And that is what we're going to be talking about tonight, is acute remedies and how to use them. So you're going to see on here, think of it for. So on each remedy, we're going to talk about when would we use this remedy. We're going to think of it for what kinds of conditions. We're going to be looking at keynote symptoms. These are going to be in bold, and they're going to be the symptoms that are most characteristic for that remedy, and then general symptoms. And then I'm going to be giving you some case examples as well. If you are watching this live, I have sent you a handout that you can print out where you can take notes. So it'll have all the remedies on it, and then you can take notes on there. I'm also happy to send you my slides if that is helpful for you. Just need to email me and ask me. So we'll start with our very first remedy, our very first M remedy, Mercurius, a huge remedy. And many of these remedies are huge remedies. And when I say that, I mean that they are useful for so many different things, and we use them chronically in so many different ways. But they're going to have a narrower focus in terms of their acute application. So we're going to be thinking of Mercurius for infections of the throat, the ear, the sinus, and the lungs. So Mercurius has a certain set of characteristic symptoms. And so if your person was sick, you'd be looking for these symptoms to be present. So let's say a person has a throat infection. You're going to look in their mouth. You're going to see their tongue is coated white, or maybe it looks dirty. And what does dirty mean? Maybe it looks kind of yellowish, whitish. It just kind of doesn't look very clean and pink like your tongue normally looks. It's really good to look at your tongue when you're healthy so you know what it's supposed to look like, as well as looking your family members' tongues to see what they look like when they're healthy. Because sometimes when I ask people this, I say, what does your tongue look like? They say, well, here's what it looks like, but I don't know what it normally looks like because I never look at it. So you should look at your tongue when you're healthy and know what it looks like. A really characteristic tongue symptom for Mercurius is marked with tooth imprints. And that means that as the tongue is pressed against the roof of the mouth and the inside of the teeth, that it gets a scalloped look from the inside of the teeth. So then when they stick their tongue out, you see that scalloped look around the edge of the teeth, around the edge of the tongue. And this is a classic Mercurius symptom. You'll see that it's in bold. So also the tonsils can look dirty, the throat can look dirty. You might see yellow or white spots, pus on the tonsils. This is, people commonly tell me, oh, I have white spots on my tonsils. There's a metallic taste in the mouth. And then especially in a throat pathology, if they've got swollen cervical lymph glands, which are right here under the jaw and in the neck, they're going to be swollen but spongy, as opposed to swollen but really hard like a rock. They're going to feel more spongy. And then this other very classic Mercurius symptom of offensive breath and discharges. Even the room smells bad when you walk in there. So say they're sleeping in their bedroom, you open the door, it just does not smell good. Everything about Mercurius has kind of an offensive, disgusting quality. So if a person were to have an ear infection, it could be an ear infection that follows a cold that had a lot of thick discharge. So say that they had a cold with thick mucus in their nose, and then that got stuck in their eustachian tube, and then suddenly they've got an ear infection, or they've got yellow-green offensive discharge from the ear with difficulty hearing. This would be a classic Mercurius ear infection. A general symptom that Mercurius patients have is increased perspiration and salivation. So you can just see everything. It's like everything smells bad. There's essentially a lot of sweating and drooling. It's really quite a state. Everything smells bad. It's putrid. They might drool while they're sleeping. Their pillow is wet when they wake up. So this is a question that I ask. And for you, if it's your children, for example, or your husband or your wife, you could just look at their pillow. Is it wet when they wake up in the morning? Do you notice they've got stuff coming out of their mouth when they wake up? Are they sweaty?
And he signed
Hey, would you mind
incredible
muting
executive
yourself?
orders and legislation to bring back proper education.
Oh, thank you so much. And then there's going to be a lot of chilliness alternating with with being too hot, because there's this narrow range of comfort in Mercurius. They're either too hot or too cold. And a good way to think about this and remember it is that Mercury is what we put in a thermometer to, because it's very sensitive to changes in temperature. It very quickly goes up and down in the thermometer because it is so exquisitely sensitive to small changes in temperature. So this translates to your patient being too hot, too cold, too hot, too cold. They just cannot find a way to be comfortable. Their pains that they have are burning and raw. So that would be like a throat pain would be burning and raw, or maybe in their sinuses, it feels burning and raw. Doesn't matter where, the quality of the pain is going to be burning and raw. Now, Mercurius, another classic keynote symptom of Mercurius is that everything is worse at night. So they might feel better in the morning or better throughout the day, and then they just feel even worse, much worse during the night. So I have a case for you to illustrate this. A 40-year-old woman with throat pain. She calls me and she says, my throat feels burning and raw. It's worst in the middle of the night. It hurts to open my mouth and stick my tongue out. My tongue is coated with white and my tonsils have a few white spots. I have a bad taste in my mouth and my husband says my breath smells really bad. The pain is the same whether I swallow or drink. Now, she didn't say that to me voluntarily. I asked her, when is the pain the worst? When you swallow your empty saliva, or when you eat, or when you drink? Now, I ask that because different remedies have a different response. If you remember from part one, when we came to lachesis, which has a lot of throat pathology, lachesis is a lot worse from empty swallowing than from eating food, which is a little bit paradoxical. Like chips feel better than swallowing saliva. So in this case, I say, what's the worst? And this is a great question for you to ask. When is the pain the worst? When you're empty swallowing, swallowing drinks, food, what temperature, etc. So she says, my glands are swollen on both sides. They feel more spongy than hard. I have a headache that makes my head feel really heavy. When I stand up and walk around, it could fall off if I don't hold it. My cough started in the middle of the night. It's worse from taking a deep breath or sitting up or changing positions. I would rather be perfectly still. I'm aggravated by moving. Everything is worst at night. I get chills and I have to stay super bundled up. I'm anxious and tired. I don't want to get out of bed. I don't want to eat. I'm sweating at night and I was drooling. My pillow was wet when I woke up. So what you can see here is that I've picked out, this is how I pulled out the Mercurius symptoms here. The pains are burning and raw. The tongue is coated. The tonsils have white spots. There's a bad taste. The breath is offensive. The glands are spongy and swollen. Everything is worst at night. She's chilled. She's sweating, perspiring, and drooling. So I pulled all these things out, but I want to just point out that there are some other symptoms, like it hurts to open my mouth wide and stick my tongue out. My head feels heavy. It could fall off if I don't hold it. I'd rather be perfectly still. I'm aggravated by moving. These might sound like another remedy that we talked about, like maybe bryonia or anxiety. Maybe that's arsenicum. So why did I pick Mercurius instead of bryonia or arsenicum when we see these other symptoms that are there that it looks like maybe I just ignored? So I created this visual for you where I pulled out all those symptoms in red and all those symptoms in pink. And we can see that not only are there more symptoms that fit Mercurius, but that each one of them is very, very characteristic of Mercurius. Whereas on the pink side, we have hurts to open my mouth and stick my tongue out. I can think of a couple remedies that have that, like maybe phytolacca. And then my head feels really heavy. I'm aggravated from moving. That's maybe bryonia. And I'm anxious. Maybe that's arsenicum. So each one of those might kind of point to one remedy, but as a whole, they don't point to one remedy. So it's about, I pulled this one out of this case in particular to show you that we want to pull out the symptoms that make up the largest aspect of the case. And then we're a little bit ignoring the other. I'm not really thinking about the headache. Of course, I want the headache to get better, but I'm not really worried about the head feeling heavy and treating that like a symptom that has to be in the remedy. So I gave her Mercurius and she got better. Um, any questions about Mercurius? All right, we'll move on to Nux vomica. So Nux vomica, another enormous remedy, lots of applications, and a sort of funny assortment of acute applications. We have here a hangover, gastritis, influenza, and urinary tract infection. It's kind of it has a lot of things to offer. So first and foremost, it treats a hangover because it's really an overindulgence remedy. It's about having too much drinking, too much food, too much drugs, too much of anything is kind of where Nux vomica's bailiwick. So we've got aggravation from alcoholic drinks, hangover with vomiting and nausea, gastritis with pains from too much alcohol or food. So now beyond just vomiting, maybe you actually have pain in your stomach or in your abdomen from too much alcohol or food. And so this could be overindulging in just having too much rich food, for example. And so that's sort of one area is this gastrointestinal area for Nux vomica. And then we have the influenza side. So there are a handful of really predominant influenza remedies, and each one has its characteristic thing that differentiates it from the others. Because when a person has the flu, they have your basic flu symptoms. They've got chills, headache, weakness, body aches. It's pretty much that's what everybody has. But they're going to have something that's more extreme than the other things. You might ask someone, what is your worst symptom? What is bothering you the most? And in Nux vomica's case, it's the violent, intense chills and shaking. So they're going to be so chilly. They're going to have chills from uncovering, chills from the slightest motion of air under the covers. What does that mean? Your person is in bed, you come, you kind of straighten up the covers, maybe you fluff it a little bit, and this is just too much. Fluffing brings air under the covers. Now I'm freezing. Now I'm having intense chills and shaking because you fluffed. It's no good. This is the level of sensitivity to cold. They're going to have a high fever with a rapid onset. This is a rapid onset remedy as opposed to some of the slower onset remedies we're going to come to later. Severe headache, worse from noise, light, mental activity, or vexation. If you don't know what vexation means, it's kind of like irritation. This brings us to the sensitivity of Nux vomica. It's a very sensitive remedy, sensitive to all stimuli, light, noise, odors. Even the skin can feel too sensitive. Maybe you've been sick with the flu and you've had that sensation of the skin just like, don't even touch me. Even lying on the sheets is hurting my skin. So Nux vomica is so sensitive. So of course, their symptoms are going to be worse from this outer stimuli that bothers them. And then we come to the urinary tract infection realm. Again, many remedies to treat urinary tract infections. And what we're always looking for is something that characterizes that bladder infection that is different from another bladder infection. So in this case, it's nearly constant urging with relieved for moments only when you pass small quantities of urine. And then there can be relief from warm bathing. So oftentimes there's frequent urging, but this is nearly constant urging. So there is never any relief from the feeling of needing to pass urine during this urinary tract infection. The mental state of Nux vomica is one of irritability and impatience, hence why vexation is so irritating to them. They don't want to be annoyed by people. This is the Nux vomica is the kind of person who has road rage, who's in the grocery store line tapping their foot and being very angry at the cashier in training, who is too slow. They're very irritable anyway, even when they're not sick, and even more so when they are sick. They may be preoccupied with their work in spite of being very sick. So if your person, your patient, insists on doing work, insists on having their computer there, will not just let it go and rest, this could be a good sign. Bryonia is also another remedy with that desire to work in spite of being so sick. And of course, they're very chilly and worse from cold, which we learned earlier, and then they're better from warmth and hot drinks. So, Nux vomica, a great remedy to have on hand for so many different things. So now we come to this remedy that you see in the grocery store checkout line that nobody knows how to say. We say Acilococcynum. That's how you say this. And this is a very basic remedy, unlike Mercurius and Nux vomica, which are huge, enormous chronic remedies. Acilococcynum really has one function, and that is it's an influenza remedy. It says it right there on the box. Flu-like symptoms, body aches, headache, fever, chills, fatigue. And those are the symptoms that you would have with Acilococcynum. So how I see it's useful is that it's at the first sign of the flu or flu-like illness, because sometimes we have an illness that seems like the flu that really isn't the flu. We don't go get a nose swab every time we have the flu. Of course, nowadays we do because we want to know if it's COVID, but we don't have a flu test at home, so we don't know. So it would be early in the illness when symptoms are vague. I just have body aches, headaches, fever, chills, fatigue. There isn't any one symptom that points to a more specific flu remedy. It's just kind of a general flu, a general malaise, fever, aching, chills, headache. This remedy is made from the liver of a duck. You can see that Muscovy duck there. And the reason for that is that it's likely that you've heard of the swine flu and the bird flu and these different flus. And that's because flu viruses reside in the livers of these animals. And then, so essentially the wildfowl liver contains many, and not infinite, but a very many RNA parts that can become flu. And so it's a great potential flu remedy. If you can see what I'm saying, it's not just H1N1, it's not just H2N5, it's every possible combination of flu remedy because all of this RNA resides in the livers of this wildfowl and swine and seals and horses. And that is where these flu viruses proliferate and then eventually come in contact with humans. We don't really get a seal flu though, because we don't really hang out with herds of seals in close contact the way that we do with pigs and birds. So here's an example that I gave you in part one. This was my son, 16-year-old boy with the flu. He came home in the middle of school. He's never done this before in his life, so this is very unusual. He had a fever. I know his normal temperature is 97, so I know 100 is a fever. He's chills with trembling and shivering. He feels cold. He's normally very hot. He's tired. He's normally hyperactive. He's cold. He's pale. He's tired, achy. He just wants to lie down. He's got a runny nose. So I gave him Acilococcynum because there wasn't anything that really pointed to something else. So this is the perfect application for Acilococcynum. Now, in this case, it did not work. And 6 hours later, there was no improvement, but the vital force spoke to me and spoke to us and gave us a new symptom that pointed to the right remedy. And this is what the vital force will do if you give it a chance. You give it the wrong remedy, Acilococcynum, and it says, hey, let me give you a headache in the back of my head right here, and then you'll know that I need gelsemium. And so that's what I did. And we talked about this as a gelsemium case in part one, but I want to point out to you that prior to that headache in the back of the head, it looked just like an Acilococcynum case. So this is a great way to use it, and it's a great remedy to just have on hand for the first sign of the flu, and oftentimes it will just nip it in the bud. In this case, it didn't, but then you just look for the new symptoms and then you prescribe based on that. Any questions about that? Okay, we will move on to phosphorus then. Gone from the tiny remedy to the big remedy again. Phosphorus is a huge remedy, lots of chronic applications, and then quite a few different acute applications. You're going to think of this remedy for nosebleeds, for coughs and colds that go to the lungs, and for gastrointestinal symptoms. So this is the most common remedy for childhood nosebleeds with profuse bright red fluid blood. And actually, it doesn't have to be a child. Anybody with chronic nosebleeds could use this remedy. So it can be used in the moment of the nosebleed to help that blood stop. This could be somebody who gets multiple nosebleeds in one day, no spontaneous nosebleeds, nosebleeds from picking the nose, nosebleeds from a blow to the nose, but even just I woke up and my pillow is covered with blood, which does happen to some people. And so phosphorus can be really great for these people who can't get a handle on their nosebleeds. So then we come to the respiratory portion, which is that this is going to be the kind of person where every time they get a cold, it goes to their chest. And this is what they say, like, every time I get a cold, it goes to my chest. I start coughing. I have a coughing pain, a cough that goes on for weeks and it never stops, like lingering coughs. So that is the kind of respiratory issues that phosphorus people have. And they might have throat pain, and again, it's going to be burning pains, this burning quality. When we come to the gastrointestinal symptoms, it can be nausea, vomiting, and then again, this burning sensation in the stomach. Phosphorus craves cold drinks, but then they'll vomit as soon as that cold drink becomes warm in their stomach. So it's not immediate, but in a little while after it has a chance to warm up, then they might throw up. And then at the other end of the spectrum, we've got painless but exhausting diarrhea, and the stool can be like a fire hydrant. I think we can all imagine exactly what that's like because I think we all now have a visual of a fire hydrant. Phosphorus can get night sweats, and then mentally, emotionally, they're very sensitive and impressionable. What does impressionable mean? It means that they are easily swayed by what you say. So if I have a phosphorus patient that comes to me and I say, you're going to feel better, everything is going to feel better after I give you this remedy, they're very likely to believe me and feel better. But if I tell them, I'm really worried about you, I'm very concerned, I don't think this is getting better, they're also going to believe that. So they are impressionable to what you say and very sensitive. And they have a kind of anxiety and fearful quality. They're fearful of the dark. They're anxious that something bad will happen. And so they compensate for that by wanting company. They want you around. They want to stick with you. They don't want to be up alone in their room while they're sick. They want company and they want sympathy and compassion. So they're looking for that connection and to allay their anxiety and fears. And then they desire these cold drinks, carbonated drinks, ice cream, juicy things. You get kind of this impression of this kind of cold, crisp, fresh kind of sensation that they desire when they're sick. And then they're very chilly. So last time in part one, we talked about a remedy called Aconite, and I gave you the case of a woman who got her daughter from the airport flying home from college who was sick, and then she got sick. And she thought she got sick from her daughter, but actually, when I really questioned it, it turned out she'd gone for a really long run in the rain and had gotten really, really cold. And so I gave her Aconite. And so on day one, she's really sick. She's been sleeping all day. Day two, she got better. So she's getting better. And I said, just continue with the Aconite. And then on day three, so that was where we ended in part one. And now I'm going to go into part two of this case because on day three, she called me and she said, my fever is gone. I had more energy. Obviously, I was raking and so forth in the yard. So obviously, I had more energy than before. But my headache came back at the end of the day, and she gives me the modalities. I have more drainage. It's kind of not as watery, but I still have this headache. It's bothering me. I had a lot of night sweats. I drenched my pajamas 3 times. My nasal obstruction is gone. Fresh air feels good. I'm craving ice cold drinks and ice cream. I typically tend to prefer warm drinks and soups. So she's kind of surprised at herself. And she says juicy fruit sounds appealing, like a juicy pear. So I gave her phosphorus because of these symptoms, the night sweats, the craving ice cold drinks, ice cream, the juicy fruit. And So on day 4, she says, I'm doing fine. Everything is a lot better. Headache's gone. The night sweats are better. I went off and did a hike. So the question really is, did I make a mistake with the aconite in the first part of the case? So I saw what I saw. She got cold after doing this run in the rain. Then she got sick. She did mention the juicy pear in the first part of the case, but I ignored it, or I saw it, but I didn't count it towards the remedy. I was pretty convinced about the aconite. And so then on day 2, she's a little better, but then really she needed phosphorus to finish the case. So the way I see it is, of course, we can't go back and undo the aconite and give her phosphorus and see how that turns out. We just can't go back in time that way. And if our main goal is to relieve suffering, we did achieve that goal because the aconite relieved her suffering a lot. I'd say about 80%. And then her vital force made it very clear to us what was needed next. And this is I bring this case to you on purpose because you don't always just give one remedy and boom, it's all better 100%. You have to be watching for new things that the vital force tells you. And now here's the vital force telling me I've got night sweats, I want ice cold drinks and ice cream, and this is not what I usually like. I like warm lattes and cozy soups, but now suddenly I want fresh, juicy pears and ice cream. So this is the vital force saying, please change the remedy. I now need phosphorus. So I consider this to be a success and not that I made a mistake. And even if I did make a mistake, it doesn't matter because we relieved her suffering. And that is what this is all we want, is to relieve people's suffering. And sometimes it takes 4 days and sometimes it takes 2 days. So we'll move on to Podophylum. This is a remedy really that you're going to be thinking of diarrhea. That is pretty much the big thing with this remedy. It's made from this little fruit, the May apple that grows in forests, and diarrhea is what you're going to get if you eat this unripened May apple. That is just what is going to happen to your body. So this is the main remedy for diarrhea in babies, which, by the way, can become a very urgent, if not emergent situation because babies can get dehydrated if they have a lot of diarrhea. So you do want to get on top of that very quickly if your baby has diarrhea. This is painless diarrhea. You can see that's in bold, painless diarrhea. And you might be thinking, what is painful diarrhea like? And that would be diarrhea that's accompanied by cramping, stomach pain, any kind of abdominal discomfort at all. But no, this is just diarrhea coming out with no pain associated with it. It can be involuntary diarrhea. Now, in a baby, of course, it's, pretty much it's happening whenever, but sometimes people can have diarrhea involuntarily, adults. It's explosive and profuse with spluttering. The stool sprays all around the toilet bowl or sometimes even out of the confines of the diaper. This happened to me one time. My baby was sitting up and then boom, that diarrhea just shot right out of the diaper and right up onto his head. And so this is it illustrates the force with which this explosion happens. So that stool can be profuse, offensive, it can be frothy, pasty, yellow, watery, it can kind of look like whatever. It can have undigested food in it. The qualities you want to see are painless and explosive. An adult might feel nausea and a feeling of uncertainty. Am I going to vomit or am I going to have diarrhea? And that would be, of course, in an adult because a baby won't be able to tell you that. And I have a little case here to illustrate this. It's very simple. My kids had this vomiting thing. My son vomited profusely for a few hours. I woke up this morning feeling nauseous, and then I had horrible diarrhea. At first, a big semi-formed stool. It was really, really big. And then 2 minutes later, just like liquid, like the hose was on. And then it went like that for 3 more times, spraying the toilet. And then I ask, is it painful? Do you have any cramping? Do you have gas pains? Do you have colicky pains? Nope, no pain, no cramping. So the remedy is Podophylum. We've got the two things, explosive and painless. And so this is just a great remedy to have on hand to just nip that right in the bud. Nobody wants to go on like that for a few days. So as you can see, these are the main things that we look for. Any questions so far about the remedies that I've talked about up till now? Okay, good. So we'll move on to Pulsatilla, another ginormous remedy, so many applications. You're going to be thinking of it for infections and coughs, infections of the ear, sinus, throat, eyes, stomach. So it's really could be many systems and seasonal allergies. These are kind of the two main acute ways that we're going to use Pulsatilla. Pulsatilla is the most frequently used remedy in childhood ear infections. So you can just sort of say to yourself, okay, if I've got a kid with an ear infection, let's give it a try. Of course, you want to look and see if the symptoms match, but it is very, very common. The ear is going to feel stopped up with pulsing or rushing sounds. An older child might be able to tell you that. You might ask, tell me what it feels like in your ear. What do you hear? There could be a painful fullness and a bursting sensation, which can often, be a lot of pain. Maybe they're just crying and pulling at their ear, but if you can get them to talk about it, you can ask them what it feels like. And their cough could be from an allergy or a virus. We don't really care about the origins of what's happening. We care mostly about the symptoms themselves and what's happening. So, cough from allergy or virus. And this is another big remedy for coughs in children. Loose, rattling, juicy coughs, juicy expectoration. That means like you hear a bunch of stuff when they're coughing. And then when they cough, a bunch of stuff probably comes into their mouth. And then if you're lucky, they'll spit it out into the white sink so you can see what it looks like. And that gives us a lot of information about what is the right remedy. So this is a huge remedy for these nighttime coughs in children with postnasal drip. That mucus is dripping down the back of their throat and making them cough. They can just have colds with a runny nose and sneezing. That could be also allergies with a runny nose and sneezing. The key with Pulsatilla is that the discharges are bland, thick, and creamy. They're opaque, white, yellow, or green. So bland means the opposite of acrid. So we talked about a couple of remedies in part one, like allium cepa or euphrasia, which have some acrid discharges. That means that when those discharges touch the skin under the nose or coming from the eye, it's going to irritate that skin and make it red. With a bland discharge, it doesn't do that. There could be tons and tons of stuff coming out of the nose, but it doesn't cause redness and irritation. It's thick rather than watery, and it's creamy looking. So it's opaque as opposed to looking like egg white or like water. So this is also a big conjunctivitis remedy, which is why we have infections of the eye. Conjunctivitis with red eyes and itching, pain and watering, and that bland discharge coming out often from either end of the eye, the outer part of the eye or the inner part. Sometimes it can get kind of agglutinated onto the lids after your child is sleeping. And then the mental state of Pulsatilla is weepy and clingy, better from company, better from attention and consolation, wanting to have affection and caresses, to be carried around. This is what they want to sit in your lap with their lovey and just get some snuggles in. This is how Pulsatilla presents as a chronic remedy. And then let's say you have a very independent, rambunctious child who suddenly becomes weepy and clingy and wanting consolation. That's even more of an indication that your child needs an acute remedy of Pulsatilla because they've changed their mental state from independence to weepy and clingy. Pulsatilla is also known for its changeability. Changeability is, in fact, a symptom in and of itself. If you find that you or your child or your patient, whoever that may be, is changeable, maybe they feel well, then they feel sick, then they feel well, then they feel sick, and you start to think, what is happening? Are they really sick? And then you remember changeability is a symptom in and of itself for Pulsatilla. They are also known for being better from open air or the open window. They want the window open in their room, in the car, wherever they are, even if you might think it's not appropriate or they should have it shut, they want it open. And they're worse from that heat and sun, and they're thirstless. So I have the pleasure of treating my mother a lot. She calls me often when she's sick, and so I'm very familiar with my mother's pattern of being ill and what she needs. And usually she needs arsenicum album. So one time she called me from Florida where she was visiting her sister, and she had gotten sick, and so she was staying with her sister in her guest room and was kind of laid up in bed and spent quite a bit of time on the phone with me in a kind of needy way. Like she wanted my company by talking to me on the phone and telling me about her symptoms and wanting me to console her and come up with a plan to make her better. So I sent my aunt out to buy some arsenicum, but it didn't really do anything. So in one of these episodes on the phone with my mom, I said, "Well, what's the worst thing about what's going on right now?" And she said, "Well, the worst thing is that I can't open the window." And I didn't even know that this was a thing, that you could even have a home where the windows didn't open. But apparently, in some apartment buildings in Florida, you would never need to open the window because you would always have a climate controlled environment. So that was the kind of place that my aunt lived in. And you actually could not open the window at all. It was like just completely sealed with no hinges or handle whatsoever. And my mom said, "This is the worst. It's the worst that I cannot open the window. I am trapped inside this room with no way to open the window and have fresh air." So I sent my aunt out for some pulsatilla because my mom was weepy and clingy and she wanted to talk to me and she wanted the window open. And lo and behold, she got better. So you never know what symptom it's going to be that's going to be the one that's going to help you find the remedy, which is why you just keep on asking questions and being a detective until you find something that's like a clue that sends you in the right direction. Okay, moving on to Rusta Toxicodendron. So we did talk about Rust Tox in our intro session. We talked about it in terms of sprains and strains, but Rust Tox, also another big remedy, has some other acute applications that we'll talk more about here. A main remedy for skin eruptions, Rust Tox is made from the poison ivy plant. You can see it there in the corner. Very similar to our Rusta versiloba that we find, it's poison oak here in California. So Rust Tox and Rusta versiloba are very, very similar in terms of their picture. And they both treat poison oak, shingles, eczema, any kind of skin rash. Doesn't matter what the origin. It just matters that it matches the pattern of Rust Tox. So also a great remedy for influenza. And as we talked about in the intro section, a great remedy for joint pain, whether that's arthritis or sprains and strains. So when we're talking about the skin element of Rust Tox, the sensation is burning, itching skin eruptions. I mean, if you've had poison oak, you know exactly what I'm talking about. It's burning and itching. It's really hard to not scratch it. And then with Rust Tox, we see small itchy vesicles. Those are little fluid-filled blisters. That's what a vesicle is. And they appear often in a line. And what that means is that you walked by the plant and it swiped you in a line, and now boom, you're having an allergic reaction in the line, how that plant touched you. And this is very characteristic of Rust Tox. And then the other thing that's extremely characteristic is that the itching from these skin eruptions, no matter their origin, is better from very hot applications. And I'm talking about when I get poison oak, I put a washcloth under the instant hot in my sink, and then I wave it in the air for 5 seconds, and then I put it directly, not on any part of unblemished skin, but just directly on that poison oak, and it relieves the itching immediately. So for me, I always need Rust Tox whenever I get poison oak. And so oftentimes people have never tried this or don't know, but you might ask, does it feel better from hot applications or better from cold applications? And people can try it out. You know, does it feel better from a hot application? And of course, you want to be safe with your hot application. Don't burn anyone. Don't have people burn themselves. You just do it as hot as you can tolerate. And then if you find that that relieves, then you'll know that Rust Tox will be helpful. Then we get to the tendon ligament aspect of rust tox, which is these sprains or strains or arthritis, and they're going to have a stiff, sore sensation, yet an urge to move and flex the joint. Now, why do they have this urge to move and flex? Because they're very restless, and the movement actually relieves the pain. So you're going to find restlessness runs as a theme throughout rust tox, and they can be restless with their skin eruptions as well, as you can imagine if it's very, very itchy. So the characteristic pain of rust tox with a sprain or a strain or even arthritis is that stiffness and pain is worst with the first motion, better continued motion. So we think of it like rust tox is like a rusty gate. So let's say I wake up in the morning, I've got a sprained ankle. I get out of bed, I put my feet on the ground, I stand up, and oh, that first motion of standing in those first couple of steps are really painful and stiff. But then by the time I walk and I get to the kitchen and I'm in there and I'm making my tea and I'm making my breakfast, that motion has started to improve the pain. So it's worse at first and better as you continue to move. Just like your rusty gate would be like, and then maybe it would become a little more free as you moved it a little bit more. And this is what you think of when you think of that pain. And this is why people with rust tox and arthritis, who have arthritis that is characteristic of rust tox, want to keep on moving, because it's stillness that causes more pain. Motion relieves the pain. So just here, arthritic pain is better from heat, dry weather, and motion. And I've had several arthritis patients who tell me this, who go out and spend all day gardening in spite of their arthritis in their hands, because it actually it relieves that pain. So when a person has the flu, they're going to feel the characteristic symptom, as we remember, we have lots of flu remedies. So how does rust tox differentiate? It's extreme achiness and this restlessness, shifting around, constantly needing to move in the bed, can't get comfortable, don't want to be still, want to be moving around. They are so, so restless. And then all ailments, whether it's the flu, whether it's the skin eruptions, whether it's the joint pain, is going to be better from heat and worse from cold and damp, actually. So, the classic cold, damp weather that aggravates arthritis is very true here with rust tox. Roomx is another remedy that has, like rust tox, an affinity for the tendons and ligaments. And so sorry, I got confused. I was thinking that it was Ruda. Nope, we're first talking about Roomx. Reset. Okay, so Roomx is a remedy for coughs. I looked at there and I thought, coughs, wait a minute, what? I'm on the wrong remedy. Sorry about that. So Roomx is a great cough remedy. And this is really the only thing you're going to be thinking of it for. It's the main remedy for incessant, violent, tickling coughs with an intense tickling in the larynx and trachea right here. So the coughs can be dry and irritated, or they can be productive and hard. Doesn't matter. The main thing you're looking for is that it's aggravated from cold. And we have other cough remedies that are aggravated from warmth. So this is a really important distinction. So they're going to be aggravated by being inside in the warm house and having to go out into the cold morning air in the fall or the winter, because that temperature differential, they step outside, it makes them start coughing. They're even going to be aggravated from undressing or uncovering that makes them cold. They're going to be aggravated from any kind of pressing on the throat pit. That's the little indentation here at the base of your throat. Or aggravated from talking, laughing, or even just breathing in. That will aggravate that cough and aggravate the tickle. So I have a nice case for you here to give you an example. 56-year-old man with a cough calls me, says, I have draining in my head, meaning he's got mucus up here in his head. It's been dripping down the back of my throat. I need to blow my nose a little more than usual. It feels moist in there, like I need to blow it or it will start leaking out. And my mucus is just watery and clear. I know this because I always ask, is it creamy and thick? Is it like, can you show me what it looks like in your tissue? My cough is mainly when I'm talking. It happens whether my voice is loud or soft. I can work hard at suppressing it if I'm careful, and it's worst on the phone. Now, this is a guy whose whole job is being on the phone. So he says, when I'm not talking on the phone, there's no cough. But as soon as I get on the phone, I start coughing. And so it's really annoying to him. He can't do his work. He's having to talk on the phone and suppress his cough. But then it's nothing when he stops talking on the phone. And there's nothing at all when he's laying down, zero cough. So he's only coughing when he has to do his work. I cough more when I go outside, and when it's cold outside, it's much worse. I'm more comfortable when it's warmer. There's a tickle, mainly in the back of my throat and in the throat pit, and it's worst when I'm speaking on the phone. The cough is not productive, it's dry. And so I'm pulling out these particular symptoms that it's worse from talking, it's worse from going outside, and especially worse when it's cold. And it comes from a tickle in the throat. So these symptoms just point me immediately to Roomx. It's a remedy I use a lot, and it's actually not in the Hahnemann Labs kit that I always recommend that everybody buy. And it's actually not on the Materia Medica that I sent you to take notes, but I'm adding it because I've used it a lot for people with these tickling coughs. Of course, they can't put every remedy in the kit, so sometimes you just have to buy an extra remedy and stick it in there yourself. Now we come to Ruda, the other remedy that has an affinity for tendons and ligaments. And so you see here similar symptoms to rust tox. We've got sprained joints, repetitive stress injuries, tendon disorders, and periosteum injuries. So this is the tissue affinity of Ruda. And so it can sometimes be difficult to differentiate, do I need rust tox or do I need Ruda? Because they do share some of the same symptoms. They're worse from cold, damp weather. It's a sprained ankle. And so what I find with these remedies is that if you sprain your ankle, the first thing you're going to need is arnica, because there are lots of tissues that are involved there, the muscles as well as the tendons and ligaments, and you've got bruising and swelling, and you want all that to come down. But if that doesn't heal up entirely, you might need rust tox or Ruda to finish the healing of that. And so if rust tox doesn't work, then you can switch to Ruda. And Ruda in particular is really good for these repetitive stress injuries like carpal tunnel syndrome, where you're using your thumb and then you get some inflammation inside that tunnel where that ligament runs, or any other kind of repetitive stress injury, like tennis elbow or golfer's elbow. And then you could have sprains with this stiffness and bruised pain, similar to rust tox. In the case of Ruda, though, it's going to be worse from exertion. So instead of feeling better from moving and motion, it's going to feel worse. So sometimes you just have to see which one is the right fit. This is a great remedy for these acute tendonitis, bursitis, or synovitis issues that you might have, or a periosteum injury. The periosteum is a layer that goes around the bone. It's a tissue layer that is very innervated, so it has a lot of sensitivity. And for example, I was on a boat one time in Massachusetts, and we were charging through the waves, and we hit a wave, and my head slammed forward, and I hit my head on the canopy of the boat. And because there's really not too much flesh on your forehead, you pretty much have your skin, and then there's your skull right there. This actually hurt for a year, where I hit my head on the boat, because it hit that periosteum. So if you get a blunt trauma to an area where your bone is very exposed, like on your shin, for example, where your bone is right there under the skin, or your skull, it can be exquisitely painful. And Ruda can really help with that. So it's another really great application for, a rare injury, but one that can go on for a long time. And we come to Sabadilla. Sabadilla is a remedy for allergies, seasonal allergies, hay fever. And just like everything else, we're always looking for what differentiates this hay fever from another hay fever remedy. For example, in part one, we talked about Allium cepa. That's another hay fever remedy. So what distinguishes Sabadilla from Allium cepa? It's the sneezing. It's where sneezing is the main complaint. And we're talking about paroxysms of sneezing, sneezing fits with 10 or more sneezes at a time, just can't stop sneezing. And these sneezes can be worse from cold, from odors or perfumes, and then they're going to be accompanied, of course, by nasal discharge and a cough, perhaps. Those are classic allergy symptoms. So here's a case I have of a 36-year-old woman with allergies. She says, my eyes are so itchy, my nose is so stuffed up. At nighttime, I can't even breathe. My eyes are itchy in the corners. They're red, watery, and swollen. This is pretty classic allergy stuff. My nose is stuffy, and then it's runny when I get up, and it starts leaking watery mucus. This sounds pretty classic allergies. My nose and mouth are itchy, and I have a little cough. And then she says, I have a lot of sneezes all at once. So many sneezes, one after another, and then my eyes water and my nose runs. So I give her Sabadilla. And it's because we have to look at what is the characteristic symptom that differentiates it. These are all just typical allergy symptoms. What is unusual here? And that is these paroxysms, these sneezing fits. And then I also tell all of my allergy people that when you get home, take out a moist washcloth and just wipe yourself down. Wipe your face, wipe your hair, and if possible, wipe your clothes, or even better, change your clothes and keep your outside clothes off the furniture so that all the pollen that's on you gets wiped off, and then you can come in and have a clean environment. So that's a little tip that I use for all my allergy people, just to keep the pollen load a little lower inside the house. And then sarsaparilla, not to be confused with Sabadilla. Sarsaparilla, you might know, is what we use to make root beer, a sarsaparilla root. We're going to be thinking of this for urinary tract infections. And we have spoken about another couple of remedies for urinary tract infections, namely Cantharis and Apis are two that we talked about. But sarsaparilla is actually the #1 choice for your classic urinary tract infection. It works in a lot of cases. And if you've ever had a bladder infection, you know that the sooner you get relief, the better. And so what differentiates sarsaparilla in its symptoms is that the pain of urination is especially excruciating right at the end of urination. So remember how we talked about nux vomica had urging, constant urging? So that would be what differentiates nux vomica. With Cantharis, it was this burning like fire. The pain of urination was burning like fire with a kind of voluptuous itching. In the case of sarsaparilla, of course, we have burning urination, frequent urging. These are common symptoms of urinary tract infection. So we've got this pain at the end of urination. And then this very unusual symptom that I've never seen in my practice, but unable to urinate without standing. Of course, this would not apply to men who frequently urinate without standing. But if a woman can't urinate without standing, then this is going to be really unusual and a slam dunk for sarsaparilla. And then we come to sepia. So sepia is such a giant remedy with a very narrow set of applications for acute care, which is pretty much morning sickness and nausea and menstrual cramps. So menstrual cramps are actually a chronic problem. So if you've got menstrual cramps, it's really better for you to go to a homeopath and get that treated, because it's going to respond a lot better to chronic treatment than to try and treat it acutely yourself. But it does have some very characteristic symptoms, so I'm going to tell you about them. So first of all, for the morning sickness, I mean, if we could just relieve morning sickness, if we could wipe morning sickness from the face of the earth, we would be doing humanity a great service. So I want everyone to know about sepia and how it can treat morning sickness. It's got the classic symptoms: nausea in the morning upon waking, nausea and vomiting with an empty feeling in the stomach. And what characterizes it, of course, there are lots of remedies for morning sickness, but that has this extreme sensitivity to odors. So I've had a client tell me, I'm up in my bedroom, my mother is down in the kitchen because she's there helping out because the baby is coming or whatever. She opens up a package of chicken and I can smell it up in the bedroom and I think I'm going to throw up because it's so disgusting. And I have to leave the house because now the whole house smells like raw chicken and it's just disgusting. So this is the level of sensitivity to odors that we find in sepia. And then there's this nausea at the thought or the smell of food. So even if that chicken is yummy and cooked, it's just disgusting to think about the food, to smell the food, and yet the nausea is better from eating. So if they can find something that doesn't smell too bad, that they can tolerate, then the nausea is going to get better. Of course, they're going to get better from taking some sepia. That's what we need to do. Now, in terms of the menstrual cramps of sepia feel like bearing down, like in the uterus is bearing down, and almost like the organs are going to fall right out. So women who need sepia will often tell me I need to cross my legs while I'm having cramps so that my uterus does not just fall right outside of my body. And that's the sensation that we find. The mental state of sepia is one of irritability and exhaustion with a desire to be left alone. You can just imagine sort of a harried mother with women, with babies clinging and children wanting and whining and I need you, and she just cannot take it anymore. And she just wants to be left alone. Do not touch me. Do not ask anything of me. Stop needing me. Please take care of yourself. And she just wants to go run out on the mountain or go for a long, hard bike ride because that being alone and vigorous exercise is what really brings her back to herself and allows her some comfort. And sepia is going to be chilly and worse from cold and has a desire for sour things like vinegar and pickles. So if you know someone who likes to drink salad dressing from the bottle and just is super irritable and cranky with some bearing down pains, you might send some sepia their way. And I've written a really nice article about sepia and on my blog, which is on my website. You can look under notes from Alexis and you can look up a remedy about the dark side of motherhood. And that is my sepia article. Silica is another very broad remedy. You're going to be thinking of it for infections of the ear, the sinus, and the throat. And also this very small little thing, yet could come in handy sometime, of expelling splinters. So silica is a really good remedy for expelling foreign bodies that have become lodged in your body. And for you, I hope it's just a splinter. We're not talking about bullets or shrapnel or anything like that. We're just keeping it minor, keeping it like down to first aid. So silica is really for recurring infections of any kind from a weak immune system. This is your kid gets sick all the time, constantly. Of course, if that happens, you really want to get chronic care for that person. But it could be ear infections all the time, perforated eardrum, you get some discharge coming out, a sore throat with suppurating tonsils, that means there's pus on them. Cervical glands are enlarged and hard. And then we have this expelling splinters thing. This is a slow pace remedy. The pace of a remedy is really important. And so it is really important for you to notice the pace of the illness in your patient. So if your patient is suddenly worse, went from fine to terrible over a very short period of time, that's going to be a fast acting remedy that you need, something like Aconite or belladonna or apis. But these slower acting remedies like gelsemium and silica, these are, illnesses that come on gradually over time. So it's a slow pace. And silica is chilly and easily chilled and is known for its increased perspiration of the head and the feet, and especially the feet are kind of smelly. So you might have a baby who goes to sleep and they wake up and they have kind of a sweaty head. Their hair is sweaty and the pillow is a little bit damp where they were sleeping. And they're better from heat and warmth and worse from wet and cold weather. And of course, you're going to be able to find lots of applications for silica in your home use book that's going to be able to differentiate, this ear infection from that ear infection, or this sinus infection from that sinus infection. Now we have spongia, a funny little remedy made from toasted sea sponge. Why would you toast a sea sponge? I don't know. We just decided to do it and make it into a remedy. We also have a remedy from an untoasted sea sponge, but we're not talking about that one today. So spongia is a remedy essentially for coughs, and in particular, croup, which is accompanied by a cough. Croup is just laryngitis. It's laryngitis in a baby. And croup can be very scary because a person's trachea is only as big as their little finger. And so when a baby with the size of their little finger has laryngitis, it means that their larynx is swollen inside that trachea, and it can cause some constriction in breathing. And so what we find with spongia is that it has this harsh barking cough like a seal, or like a saw through wood. So if you just imagine that, or I'm not going to do the seal-like cough because it always hurts my throat after I do it. But you've all been to Pier 39 and you know what the seals sound like when they're barking. So that is the cough of spongia. And oftentimes, especially with croup, there can be waking in the night with a suffocating sensation. And this is what croup is like. There is the swelling increases during the night due to the fall in cortisol, which is a natural anti-inflammatory. So that cortisol drops and then the inflammation increases. Even a little bit of inflammation increasing causes a feeling of difficulty breathing. And so then your child wakes up really scared, like they're suffocating, and then they're coughing, and then everyone is freaking out and running to the emergency room. And then what happens? You get to the emergency room and they're fine. And why are they fine? Because now you've been out in the moist, cold air, and there's been a lot of adrenaline flowing, and now the inflammation is down a little bit. And so oftentimes people who get to the ER don't even need any treatment. And so we can just nip that in the bud by using spongia and also aconite for croup in the middle of the night. And of course, if you were ever feeling like your child could not breathe, you should, of course, call 911 or go to the emergency room. But you can give aconite and spongia on your way to the emergency room. There's nothing stopping you from doing that. And I can tell you from my personal experience, I have a child who had croup about 50 times. And so I feel a little bit like a croup expert. And I used aconite and spongia very successfully. I also spent a lot of time in the bathroom with the hot shower running and steaming up the room. So I spent many nights like that and did not have to go to the ER. So spongia has this feeling of constriction in the larynx, just like I've been describing. But this cough could be from an allergy or an infection. So laryngitis, croup is a viral infection, but it could be a cough that sounds like a seal from an allergy. So that would also work with spongia. The cough is usually worse before midnight. And then it can be set off by this tickling and dryness in the throat. And it could be coughing in the day or the night. I do find with croup that people do tend to get better during the day and worse at night. But if this is due to some other reason, then it could be coughing at any time. And there can be a sensation of burning in the throat, the larynx and chest with each cough. And then that throat pain can be worse from coughing, talking, swallowing, or touching the throat. They're going to be worse from cold, dry air and cold drinks, and better from eating and drinking, especially warm drinks. So this could be a good moment to, make a cup of warm tea for your child who's feeling this way, and that could improve and make them feel better as well with the remedy. And then we come to sulfur, which is, it's ironic because sulfur is actually the biggest remedy. We would say it has the most symptoms of any remedy in our entire materia medica, and yet almost all of it is for chronic application only. And so in your case, what you're going to be thinking of sulfur for is very narrow. It's going to be skin rashes. Doesn't matter what from: psoriasis, eczema, poison oak, whatever. It could even be stings or just any kind of a skin eruption. As long as this skin eruption is burning and itching, and it's usually moist. So the burning and itching is just huge. Like they can hardly stop themselves from scratching. Oftentimes they scratch until it bleeds. There's so much itching. And the itching is worse from heat and the heat of the bed. So they get into bed at night, and then suddenly it's so much worse from being in the bed under the covers. This is the keynote of sulfur because they're hot, they're sweaty, and they're worse from heat. They can sometimes have red lips, better from fresh air. So they have this general aggravation of being worse from the heat of the bed. And that's what you're looking for. I think sometimes also you get into bed and suddenly now you're just lying there instead of being busy with your mind and your activities during the day. And then you have nothing to do but think about how much you itch. And so we come to Thuya. Thuya is a remedy for warts and a remedy for vaccinations. And so this is the most common remedy for warts. You can buy a gel in a little tube. So for example, my husband had some warts where he just put a little gel on the wart itself, covered it with a Band-Aid to kind of keep it on there and not have it just immediately come off. And in a couple of weeks, the wart was gone. So you can do this too. It's just like a homeopathic way of relieving those warts instead of using compound W or putting a coin on it or getting paid a penny for your wart or putting duct tape or the other things that I hear about for warts. It could be warts on the hands, the fingers, the face, or the nose, or even really painful plantar warts on the sole of your feet. Those are plantar warts. It can be for crops of warts like molluscum, which is something we see in babies and young children where they get crops of warts on their buttocks and legs. And then lastly, we might give Thuya to somebody who had a bad reaction to a vaccination. So let's say that you had a vaccination and the arm got really hot and red, or you developed a fever, or you just really didn't feel well. It's just kind of to neutralize the negative effects of the vaccination while allowing the vaccination to do its good work. So not everybody has a bad reaction to a vaccination, and you certainly don't need to assume that you will, but sometimes people do, and then Thuya can be very helpful for that. And then the last remedy we're going to talk about tonight is Urtica urens. This is another remedy that is not in the kit and not on your sheet, but I love it because it's a remedy made from stinging nettle. It's right there in the corner. You can take a little look at it. If you've ever touched stinging nettle, I think you can know exactly what this remedy is good for. Stinging nettle is covered with little hairs that act like hypodermic needles that inject their plant chemicals right into you, causing histamine release. And so this is essentially a remedy that causes histamine-like reactions. So it can be used for burns and scalds from hot or boiling water, insect bites, stings, jellyfish stings, urticaria, which is another fancy word for hives, cholinergic urticaria, which is where you get hives from being too hot or exerting yourself, seasonal allergies, allergic reactions, and dermographia. Dermographia is where you drag your fingernail along the skin and then it leaves a welt behind. And that is a person that has excessive histamine in their body. So burning, stinging, and itching are going to be the main sensations. It could be a red rash with burning, prickling, itching pains, itching, raised welts, or it could be vesicles. And so you could see that this could arise from allergies, allergic reactions to food. It could be a bite or a sting. You could see that any of these could apply. Again, it doesn't matter the origin, but it's going to be this burning, prickling, itching, rash or welt on the skin. Also, Urtica urens, made from stinging nettle. If you can make a tea out of stinging nettle, either fresh or you can buy it already in tea bags, is great for seasonal allergies. So if you have seasonal allergies and you want to do something natural for that, you can go get nettle tea and drink it. It tastes a little bit like grass, You can also buy nettle in capsules and take that, and it's really good for allergies. So, stinging nettle is very, very useful. I've actually gone out and collected stinging nettle and made tea from fresh stinging nettle as well. Of course, you want to make sure that it is 100% free of any kind of pesticides or sprays. So it can, if you don't have access to that, you can just go to the health food store and buy nettle tea already made. So I have a nice little case of some urticurins. I had a 7-year-old boy with a runny nose and a rash. Mom tells me that his cheeks were red after school. He's got a rash extending to his arms. It's itching and prickling. He doesn't have a fever, but he doesn't really seem like himself. His nose is running like a faucet. The rash is red and is located on his arms, his torso, his face, his legs, his back. It seems like everywhere. There's nowhere that the rash is not. It's bumpy and dry, and it's most aggravated when he's outside, and movement and sun also aggravate it. So I ask, how is it when he gets into bed at night? Because I'm thinking of sulfur. And she says, oh no, he doesn't complain of itching when he gets in bed at night. He's just got this watery, runny nose, and he says, get me a tissue all night long. So I gave urticurins, which resolved the rash immediately. But why did I give urticurins? Well, I pretty much thought to myself, is this sulfur? No, it's not. What else could it be? Let's look at this itching and prickling, and that sounds like urticurins to me. So it became very simple. It was like not the common rash remedy, and then we looked at that itching and prickling. And so that was our last remedy. Does anybody have any questions about the remedies?
I was just wondering if you're unsure, if you can use two remedies at the same time.
So I'm often unsure, just so you know, but I would say no. Just pick one that seems better, even a little bit better. Just pick one, even if they seem exactly the same, then just pick the one that seems like a good fit and just try it. And then if it doesn't work, then you move to the other one. But it might work, and so you just give it 24, 36 hours, give it a try. And if you really see no change at all, then you switch. But remember, if you think about those other cases that I talked about, like the Acilococcynum or the Aconite case, where I gave a remedy and it didn't get better, but a new symptom arose that pointed me in the right direction. And this is why we only want to use one remedy at a time, because what are we doing when we're giving a remedy? We're introducing an energetic substance into someone's body, and we are entering into, this is going to sound really esoteric, but we're entering into dialogue with that person's vital force. We're saying, here you go, vital force. What do you think of this remedy? And the vital force is going to answer back and say, I love this remedy. I am totally better now. You resolved my rash immediately. Or the vital force is going to say, no, that's not quite right. Let me give you a new symptom to point you in the right direction. And if we use two remedies at the same time, we can easily get confused. So it's very tempting to want to just like, why don't I just put one pellet from each of these bottles into a thing and then just take them all, right? Like one of them will work. And this is kind of the thought behind a lot of these combination remedies that you can buy at Whole Foods. Like Sinusalia, for example, is one of those remedies. And you look on the package and it's got multiple remedies in it in very low potencies. And what they're doing is really just saying, here are the top 12 sinus remedies. So one of them is going to work. They're not better together. They're not all working. We're just using the shotgun approach as opposed to the sniper approach. And so I like to use the sniper approach, where we just commit to one remedy, and then we see what the vital force has to say. Is the vital force responding well, or is it delivering us some new symptoms to say, no, let me get you on the right track? And I think it's less confusing, even though it takes more time. You do have to be patient, and being patient can be one of the hardest things about being a homeopath, is just being patient and waiting to see what happens. Because as parents, as friends, as spouses, we want our people to feel better as soon as possible. And so we we often want to rush. And as a professional homeopath, I want my patients to feel better as soon as possible. But the best thing we can do is be patient and just commit to one at a time.
Great. Thank you so much.
You're welcome. A lot of people ask me that question. Any other questions at this point? What I have here, I did email this to you, to all of you who are participating live, but anybody who is watching the recording of this will not have this, but if you'd like to reach out to me, I'll send you this. It's just a couple page little summary of my home clinic cases. So these are real live things that happened earlier in my career where, D had poison oak, I gave Rustox, there was no change, so I switched to a different remedy. And I think reading through it kind of gives you a sense of the real life application of homeopathy. I mean, I'm using it every week, twice a week in my home for something or another. Somebody fell on their bike and got abrasions or got a bruise, or someone got a bite, or somebody was bitten by a dog, or somebody got sick, or someone got COVID, or, whatever it is. There's always some reason that I'm using it. And that when you read this, you'll just see, oh my gosh, I could really, just use it all the time for people. The more you read it, the more you'll want to use it. You'll see applications for it. And then I'm also sending you case taking questions. This is not exhaustive, but it's a beginning for you to be able to have a script of what to ask when you are talking to your patients, whether you're children or whether it's your spouse or your friend or it's yourself. And it gives you a little bit of a roadmap of where to go. And essentially, it's tell me everything that's happening to you, tell me all the details. Tell me with the sensations, tell me what makes it better and worse. Better and worse is what we call modalities. Like when I lie down, it gets worse. So that's a modality of being worse when I lie down. Or it's better when I move around. So that's a modality of being better from motion. So you all have received this in your email. And if you haven't received it, you can email me and I will send it to you. And then just letting you know that on my website, I write a blog and I have a newsletter, and it's called Notes from Alexis. And so on my blog, I just recently wrote one called Homeopathy at Home, a short list of what you need. And so it has some resources on there, and I'm going to tell you here as well. But this is a nice resource to go and look at blogs that I've written on lots of different topics. So you can check that out. And so these are the resources that you need. Like I said, you need remedies. So if you're wanting to practice at home, you need the remedies because you need to be able to give the remedy, and you need books to be able to know which remedy to give. So you can't do it without the books. You can't just have the remedies because then you don't know which one to give, and you can't just have the books because then you don't have the remedies to give. So you need both. And in my experience, people get sick at very inconvenient times to go get remedies. So it's better to just have them on hand. And this is why I like the home kit from Hahnemann Labs, which is available from HahnemannLabs.com, or at Pediatric Alternatives. They carry this kit. It's about $165, at least at this time of this webinar. That's how much it costs, which is actually very inexpensive for 35 2-dram vials of different remedies. Oh, I can see Renee is raising her hand. Thank you for that. Hi, Renee.
Hi. I just wanted to know, do the remedies expire?
They do not expire. Thank you for asking. Even remedies that Hahnemann made 200 years ago still are effective today, but that's if they've been kept in an environment that is not going to cause any kind of problem. So an environment that might cause a problem for remedies might be this. If they get wet, forget it. So you want to make sure that they stay dry. And you also want to make sure that they're not exposed to excessive heat. Like you wouldn't want to keep them in the glove box of your car. And then also you don't want to expose them to x-rays like at the airport. So whenever I travel and I take remedies with me, and I do have a bunch of remedies I always take with me when I travel, I put them in my pocket. And then when I go through TSA security, I pull it out of my pocket and I say, will you please hand check this? It cannot go through the x-ray. And then, of course, they have to wipe it to see if it's a bomb. And then they hand it to me at the other side and I'm done. So they don't expire, but they can become antidoted if they are exposed to these extreme environments or x-rays. But given a good condition, they can last forever. Oh, somebody else raised their hand. Yes.
I was just wondering too, in that respect, can they go in the luggage? Like, do you know
The
if they
luggage is
X-ray?
also x-rayed. So
Oh, okay.
yeah, you don't want to do that. You want to take all your remedies with you in your carry-on bag and then pull them out and have them examined by hand. So sometimes people forget. And then what I'd say is if you did put your stuff through the x-ray, I can't, look with my eyes at the remedy and know that it's now no good. But you could mark that remedy like, hey, this remedy went through the x-ray. And then let's say that it's arsenicum album. And then you come across a situation where that's needed and you give it and it doesn't work. You might consider running out and buying a new arsenicum album before you went and changed remedies, because it could be that that remedy's no good. So do not put it in your luggage. And this is why I don't travel with a ton of remedies. I have a few remedies that I travel with. And of course, if I'm going somewhere, like, it depends on where I'm going. If I'm going to Mexico, I'm going to take remedies for gastrointestinal stuff, or, sunburn and bug bites and that kind of thing. It's different if I'm going to Europe or going to New York or something. So it just depends. I think I saw 2 hands up. Did somebody else have a question? No. Okay, good. So then I have some books listed here. And then also I have a practical guide that I've written. I have emailed you. And if you're watching this as a video, I'm happy to send it to you. You also automatically are directed to download it when you sign up for my newsletter, which is my notes from Alexis on my website. So this is just a little pamphlet that describes how to choose a remedy, how to know when to change to a different remedy, the basics of homeopathy. And these are these are 3 books I really like. There are a lot of home use books out there, and nobody is saying anything different about bryonia. Like, they're all saying the same thing about bryonia and gelsemium and arsenicum album. What is different about the books is that some might have a few more remedies in the sinus section, or a few more remedies in the urinary tract infection section. And so it can be good to have multiple books because they might cover a few more remedies than the other. But remedies are remedies, so everyone's going to say the same thing about arsenicum album, and everyone's going to say the same thing. So we're not having differing opinions. This is just about one person chose to add 2 or 3 more remedies to this section to maybe give you a little broader look at it. So I think it's good to have 2 or 3 books at home to refer to, so that, and as I mentioned in my intro video, you're going to open it up and it's delineated by chapter. So coughs and colds, sore throats, bladder infections, et cetera, et cetera. So you just go to the chapter that is relevant to the problem that you're having, and then you go from there, and they help you differentiate which remedy is the right one to give. And so that is me. This is my email and my website and my phone number. And I think what I'm going to do is I'm going to stop sharing so that we can chat. And I see Susan has raised her hand. I'm going to stop sharing now.
Hi there. I was also just wondering if it seems like every homeopathist has a different view on antidotes. So I was just wondering what you tell your patients to avoid in terms of antidotes.
Got it. Got it. It's so true. Everyone's like, don't eat chocolate, don't drink coffee, don't drill your teeth. So here's what I say about antidoting. I say that we cannot predict who's going to have an antidoted remedy and who isn't. So I would say, first of all, there are people where nothing's going to antidote their remedy. And then there are people who are very, very sensitive, and those people are going to be more likely to have a remedy antidote if they take a substance or something. So, for example, if I drink a cup of coffee, I feel like my head is floating about 6 feet above my body, and I feel like a zombie and like I'm going to lose my mind. That means I'm really sensitive to coffee. So if I drink coffee, it might antidote my remedy. So, but most of the time, I would say 100% of my patients drink coffee. So coffee is one of the things that they say antidotes remedies. I haven't personally seen that. But if I were my own patient, I would say, don't drink coffee, Alexis, because you know how coffee affects you. So the main things that I say to people, please don't do the following things. Don't smoke pot. Don't put camphor on yourself. That's Vicks Vapo Rub, Blistex, stuff like that, because camphor is very, very strong and is really considered to be the universal antidote. In fact, we even use camphor, the remedy, to antidote the bad effects of if somebody takes a remedy and is having a bad effect. And then x-rays, like for the remedies themselves. I also do, people do say like ultrasonic cleaning of the teeth can sometimes do that. I have come over time to really dislike that ultrasonic cleaning. So I haven't seen that. I have seen people get their remedy antidoted by severe trauma, like severe physical trauma, blow to the head or a severe concussion. But in general, I think don't worry, just don't smoke pot and don't use camphor.
Great.
Those are the main things. It's okay to drink coffee. It's okay to drink chocolate or eat chocolate. I know a homeopath who doesn't let any of her patients eat chocolate, but you can eat chocolate if you come to me. So
Great.
mint is fine. All of that. Yeah.
Great. Also mentha.
Mentha. Oh, like menthol. Yeah. Same as camphor.
Okay,
We try and avoid that.
great. Thank you.
You're welcome. Renee, I see your hand is raised.
Oh yeah, I had a different question. Now I need to add on to what she just asked because
Okay.
so for instance, so I'm being treated by you right now, you know that. And I actually do use like balms that have menthol or other like CBD menthol, what have you, for pain. So should I not use those?
Well, here's my approach. You just don't change anything about your life. We see how it goes with the remedy. If the remedy isn't working, then we evaluate. Is there something in the way? Like, are those balms getting in the way? Why don't we try a month without the balms and let's see if the remedy is working? So I think of it more like that. If we're not making progress with a case, then we look for something that could be causing a problem. And if we find something, first we change that rather than changing the remedy. Does that make sense? So right now you don't need to change anything. And then when you come see me, just remind me that you like to use these products and that we want to take it into consideration.
Okay. Then my actual question was, so I'm very interested in learning more about this at a deeper level.
Okay.
But I found that it's so hard to find any formalized like training programs anymore for this. Like to get any certification, you advise on potential places you can go to get a much deeper, like almost practitioner level understanding
Yeah, for
and training.
sure. So you cut out there a little bit for a second, but I think you're asking, can I refer you somewhere to get deeper training? And absolutely. Um, there was an online program that I did prior to beginning homeopathic school because I realized I had to become a homeopath in November. And so school had already started in September. So I spent 10 months doing an online program, and then I went to school when it started in September. And that was called the Luminos School of Homeopathy, and they had a really lovely online program that was comprehensive, but designed for, it was like the basics, and it was modules that you would do self-paced. So you could look for that, Luminos, Luminos School of Homeopathy. And then in addition to that, there are a lot of programs. There used to be schools in San Francisco and in the Bay Area, and I don't believe there are any more right now. There is the Los Angeles School of Homeopathy. Most homeopathic schools, like if you were going to say, I want to become a homeopath, most schools do a 3-year program, and you go 10 weekends per year. So it's like Friday, Saturday, Sunday intensive once a month. So 10 months out of the year. So it's not like going to college where you go to school, Monday, Wednesday, Friday for 9 months. They set it up so that people can do it if they already have a job. These are usually adults who are already launched in life, who are deciding to become homeopaths. So that's how they're organized. And if you email me your question, I'll do a little bit more research and I can give you some further resources. I haven't looked into it recently, so I know that there are places. I could just organize it better for you in an email back to you, but I'm happy to do that.
Thank you.
You're welcome. Any other questions?
Is CBD the same as smoking pot?
CBD has had this explosion of use, and it's become kind of ubiquitous very suddenly. And so I don't really know. I don't think it's not the same as smoking pot. I would say that my patients that smoke pot get kind of into a state. It's a cannabis state, actually. Cannabis is a remedy that we use. And, the THC is a fat soluble, chemical. And so it stays in the body, it lingers in the body, and it creates this kind of state. And so that is what interferes with people having a remedy work for them. I think it's to do with the habitual use of it, that it becomes part of your body and it's remaining in your tissues. I think if people are using CBD, especially topically, it's not really having that same kind of systemic effect. So suffice it to say, I don't exactly know the answer to that question, but I can say that I don't have any current problems with that with my patients. And I'm sure a lot of them are using CBD, especially topically, for pain or maybe for sleep. Like people might be taking drops or capsules for sleep. So I haven't seen that as a problem. And again, like I said before, we just don't change anything. And then if remedies aren't working, then we investigate. Why isn't this remedy working? Could there be an obstacle to cure or something that you're doing that isn't working very well with the remedy? And then we go from there.
Great, thank you.
So go ahead and use your CBD, it's fine. Any other questions for me tonight? Well, you're always welcome to email me and ask me questions. Go to my website. I have a lot of articles there. I have a lot of webinars, recorded classes that I've given in person. This has been really a fun series to do. I've really loved it, and I want to thank you all for participating. I'm going to be putting the recording of this onto my website, so you can always review it there if you had to miss part of it or weren't able to make it. So I want to thank you guys so much, and I look forward to seeing you at another webinar soon.
Thank you so much.
You're welcome. Good night, you guys.
Night. Thank you.
Thank you.